cancer case control study was conducted in Vietnam, which showed the incidence is rising rapidly with economic development. In this study, incident breast cancer cases unselected for family history or age were recruited from the National Cancer Hospital of Vietnam in Hanoi. Breast cancer cases were positively correlated with increasing weight and BMI at age 18 and increased BMI at diagnosis as compared to controls. There were no statistical differences in age at first menarche and duration of breastfeeding between cases and controls. The study indicates that breast cancer in Vietnam is associated with some but not all of the reported risk factors from Western populations. The data obtained is consistent with other studies of breast cancer in Asian populations.
Breast cancer is becoming more common in developing countries. Low and middle income countries now account for majority deaths of breast cancer worldwide. WHO says breast cancer affects 2.3 million women worldwide with 685,000 deaths. Breast cancer affects 7.8 million women worldwide in the previous 5 years as of the end of 2020, making it the most cancer in the world. In order to prevent it, many case control studies were conducted as it is a type of observational study that frequently used to investigate factors linked to a disease or outcome. The researcher must select an appropriate control group when designing a case control study. The case group is the one who received outcome and the control group is the one who did not receive the outcome should in theory have nearly identical characteristics such as age, overall health status, and other factors. Both groups should come from similar background and live in similar environments. Hence, the result can identify the exact risk of breast cancer and people can avoid it to prevent it from occurring.
Methodology. The duration for this study is from January 2007 until August 2013, which is more than 6 years. This study is done at National Cancer Hospital of Vietnam in Hanoi, Vietnam. The cases for this study are inpatient and outpatient women aged 25 to 75 years who are diagnosed with invasive breast cancer in the previous 12 months before study participation. Women with a history of breast cancer were not allowed to participate in this research. The data that has been collected from the cases are type of histopathological, grade of Nottingham, TNM stage, and ER or PR or HER2 status. Meanwhile, the controls are women aged 25 years or older who had no previous history of breast cancer and not associated to the cases. The controls are taken from both rural and urban areas. Thus, the cases and controls are compared based on year of birth, place of birth, and current resident, which is rural or urban areas.
Collection obtained by a Britain from consent, and Vietnamese researcher has done an interview about this and a questionnaire which contains information about demographic, hormonal and reproductive factors and also anthropometric factors. BMI was calculated for each study subject and classified into 4 categories, which is underweight, normal, overweight, and also obese. The breast cancer studies was approved by the Research Ethics Board of Queen's University in Canada, also the Research Ethics Committee and Administration of the National Cancer Hospital in Hanoi. According to the statistical analysis, the conditional logistic regression analysis was performed to evaluate the association of various risk factors with the risk of breast cancer, which display as odd ratios with 95% confidence interval. A p less than 0.05 was considered statistically significant and all values were too tailed.
On the studies, the result was obtained for clinical feature and pathological data. The average age of diagnosis for breast cancer was 45.9 years. Most of the breast cancer patients was tested positive for estrogen receptors, progesterone receptors, and human epidermal growth factors receptor 2, while 50% of the sample were triple negative. The hormonal, reproductive, and anthropometric characteristics of 294 breast cancer and their match control were compared. Breast cancer cases had a significantly lower mean parity and older age at first parity. There are no significant differences between cases and control for the age at menarche, breastfeeding, or in hormonal factors in the menopausal status.
The next result is about BMI associated with breast cancer. BMI was positively associated with breast cancer risk. Compared to women with BMI less than 18 kg per meter square at age 18, those with BMI greater than 20 kg per meter square at age 18 were associated significantly increased risk of breast cancer. Risk of premenopausal breast cancer. There are 196 cases and 196 match controls. Based on the anthropometric factors, there are strong association in weight at age 18 with probability 0.002 and BMI at age 18 with probability at 0.0001. Both of it are very significant.
In discussion section, we'll be discussing about the anthropometric risk factors, comparison to other studies in Vietnam, comparison to studies of different ethnicities, and study limitations. The role of hormonal, reproductive, and anthropometric as the risk factor of breast cancer in Vietnamese women is investigated in this research. Breast cancer was linked to lower parity and an older age at first birth. In our dataset, however, neither the age of menarche nor the length of breastfeeding were found to be correlated with the breast cancer. Firstly, anthropometric risk factors. In this study, greater weight and BMI at diagnosis at age 18 years old were positively correlated with breast cancer. However, BMI of Western population to define overweight or obesity is different from Vietnamese.
So, the discussion on the comparison to the other studies in Vietnam shows that they reported lower mean parity and increasing age at the first parity are positively associated with breast cancer. However, they did not find that weight or BMI to be correlated with breast cancer risk. In comparison to studies of different ethnicities, it is known as breast cancer in other Asian countries such as that risk factors varies with ethnicity, which is like, for example, for Chinese women, it is demonstrated that family history, increased BMI and later menopause was strongly correlated with high breast cancer risk. So, however, in Western populations, such as nulliparity and no history of breastfeeding were not observed in Chinese ethnicity. So it is known that the study is keeping others within Asia, which demonstrate that breast cancer risk factors may vary across different ethnic groups. As per study limitations, there are a few, which is first, study participants were asked to recall their weight and thus body mass index at age 18, while the controls were asked to recall their current weight. This is important because studies in Western populations have demonstrated that breast cancer is highly heterogeneous and risk factors may differ between breast cancer subtypes.
Breast cancer is a heterogeneous disease with variation in the prevalence of risk factors across ethnicities. In this study, we demonstrate that breast cancer in Vietnam is associated with some but not all of the published risk factors from Western populations. Our data is consistent with other studies of breast cancer in Asian populations. This has potential implications for education and health promotion about breast cancer as well as risk assessment tools of relevant women in Vietnam, where the incidence of breast cancer continues to increase annually.